Good afternoon, and hello, everyone. Welcome to the Advancing a Healthier Wisconsin Endowment statewide informational webinar on the 2021 Call for Policy and Systems Changes for Improved Health. Before we get started, I'd like to do some brief introductions. Since most of us are in a virtual world these days, it's great to see faces behind the voices that you hear. With that, hi everyone, I'm Maureen Busalacchi. I'm the Program Manager for AHW's Policy and Systems Change Pathway. As Program Manager, I work to support great ideas to make systems change to improve health. And we work from pre-application through the funding award. And we also develop programming that not only bring projects together, but also build the capacity of our systems thinkers and our soon-to-be systems thinkers. Joining me today to help facilitate this webinar is our Communications Specialist, Karen Hess. Hi, Karen. Karen will be monitoring the Q&A box as we move through the webinar and will facilitate Q&A at the end. Thanks, Karen. I also have the privilege to introduce our Program Director, Christina Ellis. Welcome, Christina. Christina can also help answer questions that you may have. Before we get started, a quick overview of webinar mechanics. I know we work in these virtual worlds a lot, but WebEx is a little bit different. So as you can tell, you're muted and your video is off. If you're having audio issues, you'll find the audio connection and speaker settings behind the button with the 3 horizontal dots. There's also both a chat function and a Q&A box. I'd ask that you use the Q&A box to submit your questions. If you don't see the Q&A box, you can find it by clicking on those 3 dots on the far right of your screen. You should have an option to open the Q&A box when you click on that. In the Q&A box, please feel free to add questions throughout the webinar, and we'll get to as many as possible at the end. Today, I will be giving you an overview of one of our 4 currently open funding opportunities we have available. Then we'll cover the application process with the new AHW online application system. And then we'll have Q&A, the best part. As a reminder, please submit your questions through the Q&A box, not the chat box, throughout the session. So let's get started. First, meet us, the Advancing a Healthier Wisconsin Endowment. At AHW, we are driven by the goal to make Wisconsin the healthiest state in the nation. To do that, we're working every day to make positive changes in health possible for all those living in Wisconsin through our investments in grant awards and the development of programming to build capacity of those like you working to improve health. We're a statewide health philanthropy that was established at MCW to serve as a resource to those working to improve health across Wisconsin. We were established following a generous gift of more than $316 million from the conversion of Blue Cross Blue Shield United Wisconsin from a nonprofit organization to a for-profit stock corporation. An additional gift of roughly the same amount was given to the UW School of Medicine and Public Health. They operate a peer endowment called the Wisconsin Partnership Program. These funds gifted to each medical school in the state are on behalf of the people of Wisconsin. We take the responsibility of being stewards of the public dollars among our top priorities. Today, we continue the mission by averaging more than $17 million a year in funding awards, which is allocated across both community-led and MCW-led projects. We hold a unique space in philanthropy nationwide. We sit within a private institution, but we're entrusted with funds to steward on behalf of the public. As such, and in accordance to the order from the Commissioner of Insurance that has guided our structure and mission, we have a public oversight body with public meetings, public reporting requirements, and somewhat unique aspects to our funding. These include our funds must be used for the purpose of improving the health of the public of Wisconsin. Our funds must remain available in perpetuity. And our funding awards we issue must not supplant resources available to these efforts. That's why many of you are familiar or will become familiar with our supplanting review criteria. We must have public oversight and an advisory board, which was established in 2003 and continues to meet regularly to this day. And we must develop and make 5-year plans that outline our strategies. Since issuing our first funding awards in 2004, we've invested nearly $273 million in more than 460 projects, advancing biomedical, population health research, healthcare, public health, education and workforce development, and community health initiatives. These projects have done amazing things. They've led to new discoveries and knowledge in science and medicine, including new drug discovery resources, new research programs to study diseases disparately impacting people in Wisconsin, new knowledge around these diseases that's advancing continued discovery in improving diagnosis, treatment, and quality of life for all people in the state of Wisconsin. Developed initiative educational pathways to support future health workforce, including new curriculums and degree programs in public health, pharmacy, and more, as well as pipeline programs for both rural and underrepresented in medicine students. And supported communities and statewide projects in changing systems that impact population health outcomes, such as pharmacies providing immunizations, down to local community-driven work to build better systems to engage workplaces, for example, in suicide prevention, reduce binge drinking, and so much more. There's like 40-some projects working on those things. Today, our mission to support partners across the state is being guided by our 5-year plan. Under this plan, we're working to advance work around 3 health priorities in Wisconsin. Those are improving heart health, supporting healthy minds, and dismantling cancer. Alongside these issues, we aim to accelerate innovation, collaboration, and impact by responding to research investigators, community, and community-identified needs. In addition, we're continuing to push even further, looking at how we can enhance current programming to build new programming that will support those working to improve the health of the public. And the thread, I like to think of it as a rope, running through our entire body of work are the critical issues of addressing health disparities and advancing health equity. We issue funding awards and have capacity building programming through 4 dedicated pathways on the screen. Webinar recordings of the research, workforce development, and population and community health studies will be available on the website soon. They also gave informational webinars earlier this week. So let's get to the reason you are here today for the overview of the call for policy and systems change to improve health. As you've noted, there's approximately $1.5 million available. These are for community-based organization and MCW academic partners to work towards solving the wicked health problem by looking at systems that are hampering good health for everyone. There's a 2-stage process, the letter of intent and full proposal. In the past, this policy and system has had a pitch process, but there won't be one this time. As you're putting together your application, you should think about who is engaged in the system that needs to be involved. Think about who this impacts and the best way to engage them in the process. Vulnerable populations may take special care. We're also looking to go beyond a focus group or having a member on an advisory board. We'd like deep community engagement. Successful applicants would begin their projects July 1st, 2021. So why systems change? The good doesn't go away when the funding does. We fund fundamental change, change in how people and systems work. We have work to do to bring Wisconsin to the healthiest state in the nation, and changing systems is critical work in that. A policy isn't enough. Applicants need to demonstrate work on several aspects of the conditions to change systems. We're also looking for sector partners to be engaged. Real systems change, not programs or interventions. We appreciate this model as a helpful strategy tool for use in thinking through complex systems changes. I know we're always working to deal with the challenging problems of our time, and this model has helped us kind of see and pull apart some of those pieces. This image shows 6 interdependent conditions that play significant roles in holding a problem in place. These conditions exist with varying degrees of visibility to the players in the system, largely due to how explicit or tangible they are made to most people. It's important to note that while these conditions can be independently defined, measured, and targeted for change, they're also intertwined and interact with each other. And systems also evolve and change as time goes on. So the top row, explicit structural changes can include inform policy, promote effective practices, and change the flow of information, human and financial resources. The second row, semi-explicit changes, include shifting power dynamics, building relationships across sectors and political divides. Transforming the system is about changing the relationships between the people who work within the system. And the really transformative change is the implicit change, the bottom. The centers on mental models and our habits of thought. So a great example is in lacrosse. Some of you may be familiar, there used to be Oktoberfest in lacrosse where drinking was kind of everywhere. They used to have an area for families that was fenced off from the drinkers. There was a big shift in thinking about how the community should handle festivals and how they ought to be run. And so now the families run free and the drinkers are fenced off. So big change in how they looked at their community and their events. So eligibility, we're looking for academic partners and community partners that would be required. If you need assistance finding either a community organization or an MCW academic partner, please let me know as soon as possible. There are a couple of changes this round. The MCW academic partner must put in 5% effort, and the community primary partner must also have effort on the project. For this funding opportunity, there's no minimum or maximum request. As we've mentioned, we have about $1.5 million available, and generally that turns out to be 3 to 5 meritorious projects. Please remember that AHW grants are awarded using a cost reimbursement model, and all expenses must adhere to our allowable and unallowable cost requirements. Those are also on our website. This includes that we're only able to fund direct project-related expenses. And just another reminder, go to the Q&A box and please feel free to add your questions there. We'll get to them at the end. Since first initiating our work to support policy and systems changes from around the state, we've invested nearly $15 million in community-led projects that are creating change both within communities and across the entire state. I'd like to share with you an example called Expanding Immunization Access to the Wisconsin Communities Project. I didn't know this, but most people in Wisconsin live within 5 miles of a pharmacy. If you think about the medical neighborhood, that's a great way to think about how could we increase our immunization rates for both children and adults. So this project is working to change protocols around the state with health systems as well as payment models to make sure that they can be part of the medical neighborhood and provide those vaccinations as people need them. They're also deepening their relationship with the Wisconsin Immunization Registry and working to make sure that training is available to pharmacists to make sure that that information is uploaded so the rest of the neighborhood knows when kids and adults have been vaccinated. They've deepened their relationships with public health across the state. And if you think about what's going on right now, this is especially important. Since March, immunization rates in Wisconsin have fallen significantly. Knowing that we have these pharmacists that are able to do these immunizations should hopefully help us get back to where we should be in Wisconsin. Also for flu season, employers aren't open. Clinics have reduced their hours. So there's the option of going to the pharmacy and getting your flu shot. So it's great that they've been able to do these partnerships, especially in the time of COVID. We also have other grantees that I want to talk about today. I have about 40 other stories, but I'm going to just limit it to 2 today. Safe and Healthy Streets in Milwaukee is with the Wisconsin Bike Fed, and they're partnering to ensure safer walking and biking infrastructure for residents citywide. They work with the Family and Community Medicine as their academic partner. Milwaukee has about 10% of the population, but they account for 29% of the crashes in Wisconsin. They need to do a lot of work to make sure that it's safe for pedestrians and cyclists in the city of Milwaukee. So they've been working with the Department of Public Works in Milwaukee and community organizations, as well as residents, so that as streets are being redone and there are changes that they're going to be making, that there's community input in that whole process, and so that there can be more safe places to walk and bike. The other project is the Healthier Children Through a Shared Service Network. They're focused on Monroe and Vernon counties. It's work with the Wisconsin Early Childhood Association, and they're partnering with the Center for Health Equity here at MCW, as well as a long list of local partners in those communities. They're creating a system called a shared service network, where child care centers partner to share costs that can be reinvested. While nearly 24 networks are available across the U.S., this project is the first to do the work that are connecting both child care centers and the children's medical homes within developmental screening to improve the quality of child care and the health and development of children. The screening tool is also very helpful to both parents and child care providers, making sure that their children are meeting developmental milestones and having appropriate expectations as to where they should be. So how to apply? You can see a number of tips on the screen. I would say one of the best things you can do is talk to a program manager, whether it's for this pathway or other pathways that you may be interested in. We're here to help. There's also another piece of the process that's a little bit different than past times, and that's where we need signatures from core partners after you've submitted the application. So that'll come a few days afterwards, so don't turn off your computer and go on vacation. We'll need your signatures in order to finish your review so that we can send you to the reviewers. So review process, we do have merit reviewers for both the letter of intent stage and the full proposal. We want to make sure that your systems change is going to address health equity. And as I mentioned before, you need to involve the impacted voice and include decision makers. So what this means is this isn't to go lobby somebody. This is everybody in the system says we need to make these changes, and they're engaged in the process. Decision makers are not only the C-suite, but they're also the IT department, for example, if you're trying to change how data is being shared across organizations. So it's important to think about all of the different folks that need to be engaged in the systems change. I'd strongly recommend chatting with me early in your process, and I'm happy to have multiple discussions with you. Systems change is hard, and it often takes several iterations. You don't need a fully refined application before we talk. Past applicants have told me it's better to chat early in the process. As you can see, we're also having virtual open houses, so please mark your calendars for those dates as well. And if you haven't already, put a question in the Q&A box, please. Lastly, I wanted to call your attention quickly to the other funding opportunities we have to engage with us. We have 3 other open opportunities through our research, education, workforce development, and population and community health studies pathways. In addition, we are seeking merit reviewers for each of the pathways. This is a great way to learn how we do reviews and engage in the process, so I urge you to take a look at that. You'll find more information about each of these on our website at ahwendowment.org/funding. And now, Q&A. Karen, what questions do you have?
This is Karen. So we received some questions in the Q&A box. The first one is regarding how to find a copy of today's slides. So I did share a link in the chat box that will allow you to download a copy of the slides. So feel free to check that out. Another question that we've received is regarding the 3 health priorities. So can you talk more about the 3 health priorities and how they are being defined?
Right, so it's heart health, dismantling cancer, Oh my goodness. And I'm blanking on the third one. Oh, healthy minds. Yes. So it isn't required that you work in those areas, but we are interested in seeing the ability to invest in those areas. In terms of definitions, there's more information within the RFA that goes into detail on that.
Another question that we received is when the need for partner signatures is that after the LOI submission?
Yes, so partner signatures are needed after you've submitted the LOI. Your application will go through technical review. After it passes technical review, we'll be asking for your signature. So it'll be a few days, and we'll be in touch about that process as well. But just to make sure that people are aware, after the LOI is submitted, you do need to make sure you monitor your email so that you can respond to the signatures that we need.
Somebody is wondering, what if you do not have all the partners in line to sign up front? Can other community partners join the project later?
Absolutely, and we find that that happens with a lot of projects, that as you're building up momentum, other partners join, and that's certainly great. I do want you to consider making sure that you have some of those main folks that you need in order to make the systems change. The other piece about systems change is sometimes we find that you need different partners than you had expected, and of course, we want you to bring those folks on board as the opportunity presents itself.
Another question is, can we access the online form early to see what is needed and page lengths?
Yes, so we have provided a Word document that we encourage you to use with your partners to share the work on the application. The online form is something that you can save and come back to, but we encourage you to get it, pretty well set using that Word document with your partners ahead of time.
Someone is also wondering about the deadlines. So they're wondering if the LOI is due 11/16 and then when that full application is due.
That full application, I believe, is due March 16th. And again, as we go through the process, we'll definitely make sure to keep everyone informed about the deadline.
Another question that we received is, can this be capacity building on current systems change funding or new projects only?
So that's another good question. In terms of capacity building, this is really, implementation of making systems change. So you can certainly build on work that you've done in the past. In fact, we have done that with several projects where they have, worked in a region or on a, a county level and then taking it statewide. So be happy to talk to you more in depth about your particular project.
So I've also received some offline questions. The first one is, are applicants required to discuss all 6 conditions of systems change?
Yes. The questions that we ask in the LOI do ask you about each of those conditions. And so it's important that you've been able to think through with your partners what you need to do in order to make those shifts. It can be challenging to kind of think through all of those different things. And again, I'm happy to chat with you and help you think about those, since we've had experience with almost 45 different projects trying to make the same kinds of changes.
Another question is, are applicants required to follow the health conditions listed in the RFA?
No, it's encouraged, of course. We want to expand the work in those 3 health areas, but it's not required.
And then another question is, what do you mean when you say that decision makers should be involved?
That's a good question. So as you're going through the process of making systems changes, it's really important to get insight and input from people throughout the process. So if you think, for example, there's some changes that you want to make between community and clinics and some other players, it's important to think about where the impacted population would start and who would pick up the phone and talk to them, making sure that you're getting insight, from basically, every level of a decision maker, people who are working on the front line, as well as people who are doing sort of that back work in terms of IT systems and information flows. Those kinds of things are important. And of course, having the folks who sign off on the memorandums of understanding being engaged as well.
And somebody is wondering if there is a limit to the number of grants they can submit for.
So in this pathway, we'd encourage that you only do one, because if you put in more than one, you are essentially competing against yourself. But you're welcome to do so if you wish. In terms of the other pathways, it's really important to know that you can't submit the same thing. All the pathways have very different and unique requirements and the things that they're looking for. So for example, population and community health is really looking for an end product, where this is looking, more for that systems change and, changing how people are doing their jobs within a system. So they're really very different things, but you're welcome to talk to all of the program managers. And if you call one of us and we need to, sort of suss out whether or not this is an appropriate one for education and workforce development or policy and systems, we're happy to do that as well.
We also received the question, for the partner signatures, what is the recommended number of partners to include?
So for that, we're looking for the primary community partner, so the person who has the authority in the organization to sign. We're looking for the PI, the MCW academic partner, and then we're looking for the department chair at MCW.
So I think just looking at the time, I will stop the questions there, but I will post Maureen's contact information in the chat box in case you would like to reach out later.
Great, thank you for the great questions. For anyone who did not get their question answered, please don't hesitate to reach out to me. I'll share my contact information again. It's also available on the RFA webpage. Those of you who submitted project-specific questions, we will work to reach back out to you. And for those of you with general questions, we hope the presentation and discussion helped answer some of them. Again, don't hesitate to reach out if we can clarify anything further for you. In addition, please note on your calendars the AHW open house dates. On those dates, we'll provide answers to common questions that we're getting, and we're also available to answer general questions again that may come up as you are further in your application process, and thinking through different things. And as you leave, please stay connected with AHW. We're on Facebook and Twitter. And there's my contact information. Thanks, everyone. I hope you have a great day.